Okay, hi, it's Dr. Buford. We're just getting started on the right leg. We're looking in the medial compartment. This is the posterior horn of the medial meniscus. That looks very good. No signs of any significant tearing here. So that is encouraging. We'll look at the body and anterior horn, and that all looks good. The articular surfaces look great. We'll take a quick peek at the torn ACL. Here it is here. This is what the torn ACL looks like. You can see how we can see all the way through the back of the knee there, which isn't really normal in someone your age. So we'll deal with that in a little bit. Before we do, hold that please, I want to look in the lateral compartment and in the patellofemoral compartment. Push down gently on the knee, please. So as you look in this lateral compartment, this lateral meniscus actually looks pretty good so far. There's a little bit of a split tear, isn't there? See that? So we'll drop the table just a little bit, please. Bend the knee a little bit more, maybe. Great. So yeah, there's a little split tear in that lateral meniscus. We'll smooth that out in just a minute. Can you get me a straight basket? The smallest one you got. We'll show you some more in a little bit. I just wanted to show you how little of the meniscus we had to remove. That should be stable now. We'll polish that, fine-tune it a little bit, but we don't want to injure the cartilage at all. And you can see the compartment's a little tight, so we're being very careful here. Push down. And work on this anterior portion just a little bit more. And I think that's pretty much got it. So we will look at the patellofemoral joint in just a minute here. And here we are looking at the top of the screen. Shaver. As you take away a little bit of the fat pad so we can see, we'll get a much better look at the patella in just a minute. Okay, so here's the patella at the top of the screen. It looks great. I don't see any cartilage damage here all the way out to the lateral facet. Roll the leg over so its knee's pointing straight up. Great. That looks good. Here's the trochlea that the patella glides in. We can follow this all the way down the front of the knee here. That looks good. So far things are checking out pretty good here, and the rest of the knee. We're going to go up on the table, and we're going to get to work on this notch. Put your body up against that for me so the leg stays. And we're going to get to work on cleaning out the old ACL tear, the old torn ligament. And then we'll get to work on reconstructing. But this is all the old torn ligament right here. Okay, so we'll show you some more in just a little bit. Okay, so here's the drill coming in just to show you how we make a hole in the tibia there. Here you go. Okay, here's our 6mm over the top guide. We're happy with that position. If I pull back, you can see we're all the way in the back. We'll show you some more in a minute. Watch this in. Okay, so we're just pulling the new graft into position. You can see it going up there. We'll pull back, give you an overall picture. That looks pretty good. Keep holding. We'll see if we can flip that button now. We'll show you some more in just a second, but that's what it's going to look like in a minute. Table all the way up. Okay, so this is what it looks like now. We haven't fixed it on the tibial side. It's fixed on the femoral side. I'm happy with the way that looks there. Hold the camera here just like that. We're going to go ahead and cycle the knee a little bit just to make sure there's good tension in the graft. Coker, I'm sorry. Never mind, I'll use this. And then we'll fix the graft on the tibial side with an 8 by 35, unless we have a 40. Whatever we have, 8 by the longest screw. Whatever the longest is. Okay, so we're straightening the knee all the way out. Look down for, and then we'll flex the knee up. And that graft has good tension on it. I'm happy with the way that looks. I'm going to put in the shaver. Push in. Okay, I just want to make sure there's no loose pieces of anything from the tunnels that we drilled. That looks better now. All right, so we'll fix this on the tibial side, show you some more in a little bit. Okay, so there's the graft. It's fixed on the tibial side. You can't see the screw, but the tip of it is just below the surface right there. And it's fixed on the femoral side with an endo button. That looks real good. I'm happy with the way that looks. We're just going to flush the knee out, and we're going to close the incisions and get you back to the recovery room shortly, okay? So I'm happy with the way that looks. We're going to get you on the road to recovery here in just a little bit. Goodbye now.